everyone, we have the acromioclavicular AC joint injury, and I'm Raquel.
I'm Hannah.
I'm Callie.
I'm Mariah.
Annabeth.
Okay, so just to start off, we'll talk about a little bit of etiology and general background about the AC joint. It is the joint that connects the scapula to the clavicle. It incorporates the medial end of the acromion and the lateral end of the clavicle, and it is stabilized by the joint capsule that surrounds it, the articular disc, its superior and inferior ligaments, and the deltoid and upper trapezius muscles. It is lined with fibrocartilage, which is a bit different from other synovial joints in our body because most of those are lined with articular cartilage. So this is one of the most common shoulder injuries in people under the age of 35. It makes up roughly 30% of all shoulder injuries and is most common in people who participate in contact sports like football or hockey. This injury can be caused by indirect trauma, direct trauma, or overuse. And in overuse injuries, arthritis is really common. So you see that a lot in people who do like moving or painting or things like that. And these dislocations that occur at the AC joint can be classified into 6 different categories, ranging from least severe, which is considered a type 1, to most severe, which is a type 6. And these different classifications take several different things into consideration. They look at all of the muscles that surround the AC joint and the ligaments that surround it as well. And then the other thing they look at is the direction that the clavicle moves during the injury, which typically depends on if it's an indirect or a direct trauma. And no matter what the classification of the injury is, there are some symptoms that are similar for most injuries. Those include shoulder pain, swelling, stiffness, and decreased range of motion. These are not for everybody, but most people who have an AC joint injury will experience at least one of these.
So the AC joint allows the scapula to remain in contact with the thorax. It permits small and subtle movements of the scapula and allows for extensive range of motion and control in the shoulder complex. There are 3 degrees of freedom, and they include elevation and depression, abduction and adduction, and upward and downward rotation. On the horizontal plane, the scapula allows movement at the acromioclavicular joint allows movement at the medial border of the scapula away or towards the midline. And on the sagittal plane, there can be movement for the scapular superior border tilting downward and inferior border tilting away from the ribs. Okay, and the muscles affected at the AC joint would be the trapezius and the deltoid muscles, considering their close proximity to the joint. The shoulder movements of the trapezius muscle would be elevation, depression, retraction, and scapular upward rotation. Shoulder movements that the deltoid assists with would be arm abduction, shoulder flexion, shoulder internal and external rotation, and shoulder extension. All muscle actions can be difficult in this injury. Okay, and as for injuries of the AC joint, it can happen indirectly or directly. An example of an indirect injury would be falling on an outstretched arm. An example of a direct injury would be a direct blow to the top of the shoulder in a game of football or rugby. Dislocation would be a force of impact that displaces the acromion process underneath the lateral clavicle. It could also damage soft tissue around the joint. It could damage fascia of the deltoid and trapezius muscles, superior and inferior AC ligaments, and coracoclavicular ligaments.
So occupations affected by the AC and joint injury. The The fourth edition of the Occupational Therapy Practice Framework identifies a broad range of occupations that are categorized into 8 specific occupations, which are the ADLs, IADLs, health management, leisure, and play. So with shoulder flexion and movement to 90 degrees, this is the ADL of bathing, dressing, and drinking from a cup. And then IADLs of lifting boxes or objects of varying weights may be affected due to limited range of motion in the shoulder. IADLs of cleaning or reaching for objects where protraction, upper rotation of the arm, and flexion at 130 degrees cannot be performed. Health management activities of working out, such as lifting weights where upward and down rotation is affected. An example of this can be pulling of a rope. And then protraction and retraction of the arm is when retraction of the arm cannot exceed 20 to 30 degrees, and then protraction of the arm will not exceed 15 to 20 degrees during rope pulling. And then occupations of play of activities include volleyball, basketball, or football. And during an overhead throw or push, the arm is unable to abduct 90 degrees or perform upper rotation of 180 degrees. And then with leisure activities such as painting, flexion or abduction of the arm is unable to perform 90 degrees or more.
Due to the newness of occupational therapy and still trying to make itself as a field as a whole, there are a few specific OT interventions that have been looked at in regards to the AC joint. One that they can use though is cryotherapy, which is a body therapeutic cooling. There are 2 types of cryotherapy, one which is a full body where someone sits in a whole tub of cold water set at a certain temperature. And then one is also just to target specific areas, such as the photo shown below is targeting the AC joint with the cooling system where you put ice in the little container and then it makes compressions and it runs the water through the tube and into and directly specific on the joint. And then occupational therapists can also use range of motion as tolerated by the patient. They can use active or passive depending on the severity or the progression of the injury.
So for the universal intervention for the AC joint injury would be the RICE method. The RICE method stands for rest, ice, compression, and elevation. During rest, you should keep weight off of the injured area. You can use a splint to relieve any extra weight. For icing, you should ice in 20-minute increments 4 to 8 times a day. And it's important to remember not to directly put the ice on your skin, as that can cause other injuries. For compression, it is shown to be beneficial for up to 1 week post-injury. You can use a wrap to wrap the injured area to help reduce swelling. You can also use like multiple socks. Like if it was specifically not for the AC, you could use like socks for an ankle, but just compression of that area. And then for elevation, it's important to elevate for 2 to 3 hours a day. So the RICE method can be used to treat injuries such as sprains, strains, or bruises. It's beneficial to reduce swelling and pain. Most studies don't have the data to support that the RICE method is actually effective. However, it continues to be widely recommended and used between multiple disciplines. It's something that most people just recommend you do, but there's no data to support that it's actually working or not working. So these are our references that we used. And overall, the AC joint injury is an injury that occurs at the shoulder, at the lateral end of the clavicle, and the scapula. Some muscles that can be affected are the deltoid and the trapezius. It also can affect many different areas of occupation due to the wide range of motions that can be done at the shoulder. Some interventions include cryotherapy and the RICE method, And that's all.
Also, the AC joint, I think it's important for us to know that the AC joint injury is super common, but at this time there aren't a lot of treatments for it. So most of the interventions for it are used for many other things outside of just AC joint injuries. So hopefully that's something that OT can improve on in the future, is finding more treatment specific for AC joint injuries.